Hi friends, I am Dr. Premendra Goyal. A lot of questions are asked to us about whether to save a tooth or to extract it. I'll talk to you about root canal treatment today, which is a treatment by which we can save your tooth and it can serve for a lifetime with good maintenance. A tooth basically is lot of hard tissue with some soft tissue in the center. You can call it the heart of your tooth, which we in our language call as pulp, and laymen end up calling it something like a nerve. Once that nerve portion or the pulp portion of your tooth is exposed to the oral cavity in some way, maybe a fracture of your tooth, maybe decay, cavities as we call them, something or the other, once that heart of your tooth or the pulp of your tooth, the nerve of your tooth is exposed to the oral cavity, your tooth is in danger. The tissue goes bad, the infection travels, it goes deeper and it enters your bone area. Now, to save that tooth or not is the first question that comes to the mind. By saving that tooth, we are ending up saving a natural tooth or a natural thing which nature has given us. We have been trying to replace or replicate what nature has given us, but 100% replication of what nature gives is not possible till date. So the option always is to save a natural thing, and that can be easily done by root canal treatment. In root canal treatment, I'll try to explain it in as simple a language, as simple the procedure is for the patient. I'll reiterate, for the patient, for the clinician or for your dentist, it definitely is a process which involves lot of intricacies, but for a patient it is a very simple procedure wherein local anesthesia is given, the area is numbed with local anesthesia and you don't feel any pain when you undergo the treatment. A small hole is drilled on the top of the tooth. If it is a grinder, if it is a front tooth, a hole is drilled on the back side of your tooth and the nerve area is accessed. And with small instruments, the inside, the root area of your tooth is cleaned up, it is shaped, it is disinfected with lot of medicaments, and then it is finally filled up with the artificial material. And then your tooth is restored to normalcy, maybe with a cap sometimes, or as we call it, a post, which is a support inside the root and building up with a tooth colored material or a material of your choice. I'll give you a broad overview of how a root canal treatment goes about in a pictorial representation. Suppose this was the decayed tooth. A small opening is made on the top of the tooth. We enter the tooth with small instruments, and with the advent of newer technologies, it is possible today to complete your root canal in one single sitting, a half an hour to 45-minute appointment, and you can end up with a painless tooth. Once the root canal is cleaned, it is disinfected with certain medicaments, artificial filling is placed in the root, and then the tooth is restored on the top. So the question of whether to save a tooth or whether to extract a tooth ends up with a proper restored tooth which works for a long time serving you. Thank you. For more information, you can contact us via Lybrate